Chairman Bartlett.
I do a comms check. Can you hear me?
Yeah.
All right, thank you.
You're live.
Thank you. I'm going to wait just one more minute. See if others join us. Hi, Sarah.
Sarah Stabenow. Hey, this is Greg, Veterans Office. Hopefully you can hear me. I'm hoping to get a hold of you. Hope maybe tomorrow to schedule a time from the emails today to help with that order. Thumbs up.
Doesn't look like she can hear you.
I know. I think you're correct.
Sarah, are you there?
No.
She's not.
Muted.
Well,
No, but
Chris,
she doesn't look like she's listening at all either.
No, she doesn't. She doesn't look like she can hear any of us.
Chris, maybe you can help. I'm looking for a credit card.
I've got one.
All right. Sarah said she'd help me out.
You could just come get mine if you want.
Okay.
Because it's got a lot of, I mean, there's not anything on it, I don't think.
Hey, Greg, when you're done with the credit card, can I use it?
you can't. Yeah. Yeah.
Just
Trying to do a resource purchase, and I don't have a government credit card. So
Come on, Greg.
Oh, there
Oh,
she
now
is.
she can hear you.
All right.
Sorry, I was having some hearing problems. I don't know.
So thanks for emailing me back. So there's no urgency on any of that. I just had a bunch today, bunch going on tomorrow, but I'll get back to you. We can schedule a time, and you can just plug right into my screen, and we can walk through that to purchase that resource.
Sounds good. My Google Calendar's up to date. Just pop something
Okay.
in on Monday or something.
All right. Thank you.
Sounds good. Thanks.
Yeah.
Well, it's exactly 5:30, so good afternoon, everybody. I'm going to call to order this meeting of the Dunn County Health and Human Services Board for February 25th, 2021. Welcome to all of our Dunn County residents who are joining us on our YouTube channel. I will go ahead and call the roll. Bonnie Barker.
here.
Sarah Kennedy.
Here.
Jody Cromry.
Here.
William Lamb.
Here.
Good. I'm here. Sarah Schaefer has not yet joined us. Supervisor Steen has not yet joined us. We also have Bob Coulson with us, our county zoning administrator and planner, and Chairman Bartlett has joined us. Welcome, everybody. Krista, do we have any public comment?
There was no public comment.
Okay, thank you. We need approval of the minutes of the January 28th meeting. Note you have two documents because we held a public hearing also on that day, but I think one motion to approve the minutes from January 28th, Health and Human Service Board will suffice. Is there a motion to approve the minutes?
I'll make a motion to approve.
Bonnie Barker moves. Jody Cromry seconds. Any comments, any additions, corrections, changes? Hearing none, all in favor say aye.
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 All right.
Any opposed? All right, the minutes from our January 28th meeting and public hearing are approved. Item 5, items placed at the request of the chair. This is a discussion of the county's directional plan. And we have a possible action item related to it, but after Mr. Coulson kind of walks us through the process, we'll have some additional discussion about where we want to go ahead with this. And you all had the directional plan in your packet, and I hope that you've had a chance to look this over. For some of you, I recognize that it was probably brand new. Mr. Coulson.
Good evening, everyone. Thanks for having me at your meeting. And so I do want to speak to you about the directional plan. I'll give a little brief overview, and then I will bring it up on the screen so that we can look at it. But just a little background on it. It's a plan that is really designed for the county board to make decisions and to be proactive government. It has some initiatives. It has some things that we've been working on. I know that most of the committees that I've been to, and when I look at the plan, that almost all of the issues in the plan have been worked on to some degree or other. And the fact that only 4 of the initiatives are on the front of the plan does not mean that those are the only 4 initiatives that the county is working on or that we should be working on. And so with that, I'm going to share my screen. So hang on just one second. All right. Can everyone see the directional plan on the screen? Is it up there?
Yes, Bob.
Okay. So how do I get that to go scroll? Here we go. I got to move something. Hang on a second. Bear with me. All right. So the directional plan, like I said, it's a plan for the county board members and the standing committees, and then they will kind of work with their support staff from each committee to work at the pieces of the element. And this is all geared towards the top of the pyramid, proactive government. And on the way to the top, these initiatives those 5 initiatives that are at the bottom of the pyramid, on their way to the top, we want to develop a policy, but those policies somewhere or another need to touch on issues of sustainability, of public engagement, of board engagement, quality of life, and then we could deem it proactive government. And we're all moving towards the vision of provide quality public services that protect and empower our citizens in a cost-effective manner. So that was adopted back in 2016 and was amended in 2018, where we added the 5th initiative, develop a broadband policy. So I know that this group, the Health and Human Services, you're not on the front page here, but I'm going to scroll down and look at there were 10 initiatives that we looked at, and in terms of, and realize that these were the initiatives that were on people's minds at the time that this plan was being developed and adopted. There are things that we have today that aren't listed in here, but maybe kind of embedded in some of these. For example, the health policy, and the question is how can we incorporate health and well-being into all policies? I think probably more today than especially back when this was developed and adopted, given the health situation that we've gone through and that we're continuing to go through. I think that that the health policy is as important or more important today than it was back then. And so a little bit of confusion kind of surrounds the plan, and I think it's more geared towards it not being placed in front of the group often enough to understand what it is that you're supposed to be doing, or how you're doing, or what you're not supposed to be doing. And so part of this discussion is to kind of bring you up to speed in terms of what it is that the plan is intended to do. So for example, with the Health and Human Services, out of those 10, probably the number one, and these aren't in order. It's just that number one, we have to give it a number. So it wasn't the most important, but the health policy. And I would venture a guess that there are a lot of health related programs that are being implemented, maybe being worked on to bring to fruition, maybe some that are being retired, but I think that there's a lot of information and programs that this group works on a daily basis, and on a monthly basis gets reported at the committee level as to where we're at, what we're doing, where we're headed. What's missing, at least from the directional plan, is a policy statement that says, this is who we are, this is what we want to do, this is how we're going to do it, this is the measurables, or kind of that kind of language. And I realize that may not be the forte of everyone, or maybe anyone on the committee, and that's okay. You guys have staff, myself and other staff members that are supporting this plan, and are working, will work with this committee and other committees to help you to stay on top of your portion of the plan, and to move forward. Now, given that there's 10 initiatives shown on here, that doesn't mean that those are the only 10 in the whole world. Some of those may not even be relevant anymore. There may be something on there that isn't on there that this group feels, boy, we really need something else that's not on there. And that's kind of the role of your committee, is to keep the plan in front of you, keep it fluid, and keep moving towards doing that proactive government. So when we're looking at these health policies, it's really just it's a statement that we're going to craft and work on, and it's something that I can pull something together and ship it off to the group. I can certainly, if there are members of the committee that want to sit down and work with me one-on-one, and we could tag team and craft this together. But at some point, there's going to be a statement or a paper, or a document, if you will, that will be presented to this group for discussion, and ultimately at some point for adoption or approval, and then you can start working on it. It's entirely possible that you have enough stuff on there to write the policy and say, we're already at proactive government, we want to do something else, and figure out what that would be. So I guess the direction that I think would be important would be to realize that you do have supporting staff other than at your standing committee that will work with you. But before we get into that, I guess what I would like to do is see if there's any kind of discussion, Q&A, what's on your guys' mind about maybe how the plan works, why it works, what are we supposed to do, how do we do it, when is all this stuff going to come due? Kind of those questions that we could have amongst ourselves to kind of help you guys to understand a little better just what it is that we're trying to do here. So with that, I guess I'm going to mute myself and put on my listening ears and just hear what you folks have to say, and see if I can't help to alleviate either some confusion or get us pointed, or at least looking in the same direction. So with that, I'm going to turn it back over to you, Chairman Morehouse, and we'll see just where we go.
Don't turn off your microphone just yet. I was going to suggest, if I might add to the suggestion that you just made, that it would be appropriate to hear from the members of the committee about whether designing a policy that would elevate the importance of public health in all of the county's decision-making is appropriate. I'd like to know what you think about that.
And I'm not going to mute myself at all. I will always be live. So
Okay.
I'm just not going I will listen and comment as I need to.
I just wanted to have you comment on whether that's an appropriate direction to proceed. To sort of focus on whether this is, whether that is important to the members of the committee.
You know, I think that when you're developing a policy for a program or a set of programs as broad as public health, it seems to me that your policy needs to be broad enough that it's going to encompass the work that you do, so that you don't have to come back. And so if that's the question, yes, I think it does need to be very broad and cover as much as you know today, but also be flexible enough that you can just plug new things into it as you move through it. So was that the question?
Well, no, I mean, what I wanted the committee members to comment on is this important to you? Shall we proceed with working on this? What do you think about its importance, its relative importance in the work that we do as a committee and in the work that guides the county board? Anybody want to weigh in on that? Sarah, Miss Supervisor Kennedy, sorry.
Well, with all that's been going on in the last year and a half, I think that the health policy needs to be front and center. So whatever we can do to strengthen it or whatever is probably what we need to be working on.
All right, thank you, Supervisor Kennedy. Anyone else want to weigh in? Supervisor Cromry.
So this is my first time reading something like this, so forgive me. But my main question was, since it's such an overarching general kind of question that we're asking about health policy, is there something in appendix or further chapters in this that detail specifics within that overarching question, or is that something that we come up with as we work together?
I must tell you that I asked that very same question, Bob.
Would you like to expand on that a little bit?
No, you go ahead.
That's an excellent question, and I am surprised that two people of the same committee asked the same question, and so I think that that just shows that there's a level of curiosity or need to understand things before you move ahead with some of this stuff. I can say that I can certainly provide you some appendices that deal specifically with the information that we dealt with back at the time, that dealt with the Health and Human Services kind of platform, if you will. I think that what you'll find is that it's dated, and the questions that they were asking back then were geared more towards budget, using the document for a budgetary planning tool, and not so much as we're trying to use it now in terms of a directional plan, in terms of just the identity of your committee and the inventory of work that you folks do. So I certainly can provide that. I don't know that it would be as helpful as one might think in terms of doing this. What you're really trying to do is to agree on a policy, a statement that says this is what this committee is all about. These are the things that we are working on, that we're think are important, and this is kind of how we're going to do it, kind of those things. But and less about how we're going to do it, more this is the scope of, this is who we are, and kind of our charge as a committee. And that's think of it, when each of you first got on the committee, if someone had given you a statement that said, this is what Health and Human Services is about. These are the things that are important to us. This is what we're working on. This is where we're headed. That's kind of what we're trying to craft so that you as a committee have some direction and can kind of plug into it, and B, as the committee structure changes, there's some consistency in bringing people on board and getting them up to speed, if you will. But I can certainly make those appendices available to anyone and everyone that wants one. Just let me know. I will have to probably sit with you, or at least we'll have to talk on the phone to explain, what the information there is, how it's gathered, and maybe so you could understand it, because you almost have to have been part of the process to make sense of maybe what some of that information is. And that's probably not what you want when you're putting stuff in the appendices. That should be maybe a little bit self-explanatory, but it's not. And I think Chair Morehouse could maybe testify that it's there's a lot in there, but I really don't know if it's as beneficial as one might think for the exercise at hand.
Huh?
Thank you.
Supervisor Cromie, I have to tell you that in going through those appendices, I found it distinctly unhelpful as we move forward. So what I really wanted us to do today as a committee is say, is this important for us to spend some time on? And if it is, looking at health policy that would govern the work of the county board, what I would suggest, I have not run this by KT at all, but to solicit ideas from you that you would share, and work that we then would do on crafting some draft language for health related policy that would come back to us at our March meeting. The expectation here is that the committees give this consideration during February and March to report back to the executive committee. So the question that I'm posing to you is this important? Does this seem like something that the committee should spend time on? Supervisor Kennedy has voted yes. Any other commentary here?
I
Ms.
looked at
Barker.
this. Yeah, I was thinking that, it's really nice what Bob said, for anyone else coming into the committee, having that unifying, having some idea of what you're coming in. Because I kind of came in blind when I came on and I didn't know. But to craft something that is encompassing, but also is relevant not to us just now, but also in the future. I deal with school policies. I'm telling you, they're always having to be updated because new things come along. And to try and craft something that is going to stretch beyond this year when we're in this COVID frenzy, to go beyond that, to look at an overall scope, and how we can craft it so that multiple things can be layered in it. It's just my thoughts.
But is it, Ms. Barker, is it worth pursuing?
Well, like I said, I think that it's important to have some sort of a statement so that as we change our parts, that someone coming in would have at least an overall statement or a overall guidance, kind of.
Okay. Any other observations, comments, sense of the appropriateness of going forward with developing some draft, hopefully language that would encompass what Ms. Barker is talking about and the importance of health policy in this county, worth pursuing for next time?
Hi, this is Bill.
Mr. Lamb.
Yes, hi. I agree with Sarah and Bonnie. So I do think it's worth pursuing further, yes.
Okay, thank you. Thank you, Bill. Well, we will come with KT's permission. I hate to add something to her plate, but also with the support of Bob to come up with some draft language that we will circulate for comment and come back to at our March meeting. Yes, no? I see. Yeah, we do have an action item for it on the bottom, so we will take that step, but that's the sense of the committee. Mr. Coulson, do you have anything to add?
I would just like to, just reassure KT that I don't expect, given her workload right now, I don't
Right.
expect that this is going to fall squarely on her shoulders. I think that what I would end up doing is having a brief conversation and as conversation as long as we need so that we feel comfortable that about the direction that we want this thing to go in, and then I would do the bulk of the work in getting the first draft. I would run it by KT to get some input before we would send it to the committee as a first draft. So I just want to reassure KT that her expertise is going to be invaluable, but I don't necessarily think that she is going to have to do a heck of a lot in terms of crafting this, other than keeping me on the straight and narrow.
And I pledge to work with Bob on this, and I'm sort of fiercely protective of KT at this point, but yes, we need her expertise. Yes, Ms. Barker.
Just wondering, has anyone explored looking to see if there's something already crafted somewhere
Well, that's
else?
the first thing I will do.
I've already started looking at some of those things too.
Okay, because I'll help too, but my help would be, hey, let's see what's out there.
Good. Okay.
Yeah, I'm not afraid to go and I don't like to reinvent the wheel, but I'm not afraid to go out and put another spoke in it. If somebody else has done that work, and that's we'll make good use of our time. I would also suggest, Chair, that going forward, that once this has, we get this policy statement that your group is behind, I would recommend that on an annual basis, at least on an annual basis, that this be placed on your agenda.
Absolutely.
For detailed discussion, so that everyone can chime in as to, is it still relevant, and B, this is really where we're headed. Do we all agree on that? So I would make that suggestion.
Yeah, an appropriate suggestion too. KT, you turned your microphone on. Did you want to weigh in?
So I would just share that Health in All Policies, there's a robust body of work around that topic, both from the National Association of City County Health Officers, as well as some of our local associations, and then looking just as close as Eau Claire, the city of Eau Claire, they have a health chapter in their directional plan. So there are many, many resources that we can tap into, so that, again, like Bob had shared, we're not recreating the wheel, we are adding a spoke to it, or maybe making it more of a Dunn County wheel.
I thought the Eau Claire material was a good starting point.
KT, if I could ask that maybe you send me a link to that material, please.
Sure.
Thank you.
Any other discussion on this topic before we move on? All right, we'll take a formal action in our long list of action items today. Thank you, Mr. Coulson.
And if it's okay with the committee, I'm going to stop sharing, and then I am probably going to check out of the meeting. Unless there's reason for me to stay around for the end of the business, sir?
No, I think that's just fine. Thank you for
right.
your help on this very much.
Thanks for inviting me.
All right, we are at item 6, the Veterans Services Office report. Mr. Quinn, you are on.
Good evening, everyone. I'll start with my overall report just based upon the narrative submission. And I'll just kind of go down each of the areas. Locally, I think it just in this week's paper was information regarding the receipt of a donation, which is kind of it's a secondary item. Our office is just partnering, trying to come up with enough funds and the coordination with veteran service organizations to say build Veterans Eternal Flame Memorial that came from the downtown offices. And so still in the planning phases, and we have now with this $1,000, we're at $5,800 towards that project. The lead on that is going to be the VFW here in Menominee, and we're in the process of moving the funds to that organization to manage that. So it's outside of the county, since it is a veteran service organization project. So we're just a partner. We're not going to be the financial stewards of that. Nothing significant to report regarding state benefits. On the federal level, and it's worth emphasizing, I've talked about this briefly in previous reports, but it's highly significant that we're able to have virtual Board of Veterans Appeals hearings, and our involvement in that is absolutely beneficial for our local veterans by having them just come to our office. We're able to conduct that because we have the technology, we have the bandwidth, which again, out in our rural areas, that doesn't exist. And these are, when we're waiting 4 years, in some instances 5 years, to get the appeal on the docket, we don't want to have any of these other friction points that exist for our veterans. So that is still going smoothly. And even tomorrow we have four virtual hearings. They tend to schedule them on Fridays. So that part's a good option for our veterans to have and working with us. We do on the just a financial highlight. We do have an action item, and I know that is on the bottom of our agenda tonight. So I'll go into detail or answer questions regarding that at that time. And we're still operating fully staffed. There's 2 of us. We still have 1 volunteer that's coming in 8 to 10 hours, and we got 2 other volunteers that are kind of on hold waiting with the COVID vaccines, and then they'll be in our office to help us once they obtain their vaccinations. If there are no questions regarding that part of it, I'll move to the workload report. That is kind of the big Excel looking sheet that you have, and you actually have 2 of them from last month's report. I'd indicated I would provide a previous year, so you can do a little comparable, and I think that's the best way, and we're quantifying anything. So as you can see, if we do a comparable of January 2021 versus January of 2020, they're very similar, and that just kind of the roll up as far as contacts and records touched, activities, and preparation for veterans benefits and all the categories, as well as capturing medical equipment that is loaned out as kind of a secondary thing that we run out of our office. Impact statement. I more commented on our direct contact for our veterans, and again with that direct visual as far as providing that customer service, which I feel is important, and based upon the feedback from our veterans, that is an important thing. And I just wanted to note, and based upon our requirements, anybody entering into our first level of our CSB here have to complete a contact sheet. And so we counted up all of our contact sheets from the beginning of the pandemic and come up with a number. So I want to again quantify that that we've met with 321. It's identified as 321 individuals. I would put husband and wife on the same sheet, so it's, you know, probably a little bit higher than that. But I wanted that to be highlighted. The other thing is I thought it was noteworthy as well, is that doesn't count the as I'd call it, the parking lot efforts that we make. And I think that I'm speaking probably for some of the other directors here of the number of visits that happen out in the parking lot during this pandemic. And so, and even with the medical equipment, in all accounts, we'd make every effort to take the equipment out to folks and pick it up outside. So in the end, with all of that, we've been able to manage all of that safely without receiving not one contact tracing phone call. So I think that's noteworthy in the services that we're delivering. There are no questions regarding the workload report or the impact statement. I can move into the 2021 expenditure revenue, which are in everybody's packet. And you know, we have a small budget, so there's nothing significant at this point to report. Outside, I had mentioned we'd received $1,000 donation, which will be passed through. That we receive it, and that'll be in a further budget adjustment so that we can get that as part of our a check cut that'll go to the VFW that's for designated funds for the Veterans Eternal Flame project. Any questions from the report that I've provided?
I don't have any questions, Greg, but I particularly appreciated seeing the cumulative records from last year. These reports are very helpful, but that was particularly useful, I think, for us.
I'll intend on making sure that we have that comparable in the packet each month.
Yeah, that's great. Other questions or comments for Greg from the committee? Anything else?
Nothing further to add. Thank you.
All right, thank you very much. Moving on to the Department of Health. We have several things on the report docket. KT?
Thank you. So first, you guys got 2 emails from me today. Really do trying, wow, talking is hard today, I apologize. Trying to be more timely in what we're getting out to you, but also trying to be responsive to our situation changes daily and hourly. So I want to get you the most updated information around cases and vaccination rates. So I appreciate your patience, as that is often going to come to you day of with some specifics from my report. So the first sets, just like last month, of documents you received are 2 reports that our Regional Public Health Consortium out of Polk County puts together on our behalf. So I'll go ahead and share my screen just for a quick visual reminder. And so this looks familiar because it's also part of our update on social media. We have gotten a lot of feedback that the color combinations are really challenging, and you can see that even though this is pulled directly from the state website, it's hard to tell where's high and where's medium. We are at high, and you can see, what is that, Sawyer County, Rusk County maybe? I get a little confused up north, that they are indeed at medium, and so that is the differentiation of color. We don't have anybody in the state that is at a low activity burden right now. I did want to highlight, and the county manager did a great job elevating this concern as well. As we are seeing more vaccinations, people have maybe reduced their interest in testing. Part of that is because we're seeing naturally a reduction in cases, but part of it, I think, is a fatigue, quite honestly. And so we only had 3 people come through our National Guard supported testing site. And so that is an incredible challenge. Mayo has also reduced their numbers of days testing. down to 3 a week, and you have to incur an urgent care cost, which may be a barrier for some of our under-resourced folks here in Dunn County. But Stout has really stepped up, and they are providing PCR testing for K-12 students if they need a test to go back for an abbreviated quarantine through their surge testing, which is, you guys will remember, is a federal resource. So that's an update on testing. And then again, the reason I give this to you guys in its original format is because all of these links are live. And so in all of your extra time, which I know you don't have, or maybe in your insomnia, which maybe you do have, you have something to go through and kind of update from that perspective. The other PDF that I sent you is a graphic on our hospital numbers. And as you guys can see, this looks really good. And then, is this visible? I see you guys kind of leaning in, which makes me think that maybe
it is.
It's not. Okay.
It is.
Okay. So we continue to see our health system partners having an incredible capacity for the normal business that they do and a reduction of COVID hospitalizations. We still continue to have 2 here in Dunn County, predominantly in our older folks. But what we're seeing is that monoclonal antibody treatment, when administered within the first 5 days, is just literally a lifesaver. And so we are seeing a significant reduction in hospitalizations. And so that's good news to continue to share. And then with the situational update that I sent out just 15 minutes before our meeting today, this should look familiar. This is our social media post. We're still playing around with vaccination and how we represent that to folks so that the data is more than just numbers, but actually shares a story. We haven't gotten it quite right. We're continuing to work at it. But what I did want to show you guys as you guys wade through the pages is that we are adding information from the DHS website about immunizations here in Dunn County. So a couple bits of information that I want to point out is that we have had 7,613 doses delivered to Dunn County residents, and about 11% of Dunn County residents have received a first dose, and we're just over 5% of Dunn County residents who have received a second dose. The other number that's really important for folks to have some awareness on is that we're at about 47% of our seniors 65 and better have at least received a single dose. And we want to get to about 50%, and we're absolutely on target to do so before we open to other 1B eligible groups like educators and childcare providers. And so we're really coming up to that. The state has done, I would say they've been responsive in their calls for geographic equity in allocation. So Dunn County did not receive allocations at the start, and we did start a little bit late, to be quite frank, getting through the vaccinator process. And as a result, we are at a lower percentage of vaccinated population as it in comparison to many of our surrounding counties. But we are making up for that. And so I know that Paul had shared that we received 330 doses this week, and we are continuing to vaccinate 65 and better healthcare providers, first responders, and law enforcement folks. And we do have appointments available for those groups for folks that live, work, or go to school in Wisconsin, so on Friday. So that's something to remember. And then I wanted to pull out the data on how many shots has the Dunn County Health Department given. And we're at 645 shots delivered through the health department. And that's broken down by first and second shots in the report for you today. I think that is the sum total of my report, if you guys don't have any questions.
Are there questions on the COVID-19 status report for KT? Hearing none. Oh, Chairman Bartlett.
For myself personally, we ended up going to Barron County to get our shots. We had our second one Tuesday. Are we counted in their numbers or in Dunn County's numbers?
So that's a fantastic question. You're counted in the state's Dunn County resident numbers. So when you look at the 7,600 shots in Dunn County residents, you're in that total. When I pull out by clinic, how many shots did we give? Of course, that's specific to the shots we put in arms here. So I think that it's important to know. So for example, I got my shots here, and I am an Eau Claire resident. So while I'm in the number of shots that our public health nurses have delivered, I am not in the Dunn County residents that have received a shot. Does that kind of make sense?
And then a follow-up question, realizing that you have some open spaces for tomorrow. If those don't get filled up with 65 and older by a certain time, can you go ahead and start giving shots to people that are a little bit younger, say in our Dunn County family, or can you draw from someplace so they don't get wasted?
Sure. So the cardinal sin is wasting a dose. We're not going to do that. My schedulers have worked all day today, and the schedulers, actually some of Chris's staff have also helped. So we've filled a substantial number of the appointments we have for tomorrow, but we still have some left over, and we'll continue to take phone calls tomorrow and get people in for a vaccine if they qualify. But if at the end of the day at 2 o'clock, we don't have enough people coming in to fill those slots, we will find arms to put them in, really trying to focus with some of our Dunn County family here in the building, but also some of our identified 1B eligible next phase. So some of our educators and childcare providers, so that we can get a jump on, so we can use those doses to our best ability. I really want them to go into everybody that's 65 or better, because we do know that the health outcomes associated with infection are so incredibly increased. But we will not waste a single dose.
Supervisor Kennedy.
Well, the medicine shop here at Menominee is giving a lot of shots. I finally got mine there on Monday because I had such a hard time getting into Mayo. So.
Sure, and we really do appreciate our medicine shop partners. They have stepped up and have made their internet portal fairly easy to navigate. I think one of the challenges is they are also finding that out-of-state residents are willing to travel. And so that's a challenge. One of the things we're trying to do by partnering with the ADRC and using the phone-based system that we have is to support our seniors that are, as Supervisor Bjork had said last month, maybe not into the computer thing, or may live in a place where there's not good access to internet. And so we are trying to bridge that gap a bit.
Other questions? If not, KT, you can move on.
Sure. So the next thing on my list is the health advisory that I sent out today, really under my role as health officer. And I'll just bring this up onto the screen so that you guys can see it as we're talking. It is just, again, in my capacity, encouraging strongly that people continue to wear cloth-based coverings, providing links to CDC data of a variety of observational studies and retrospective studies showing how things have worked in a post-COVID environment. And it also just, it begs the question, people are really tired of doing the things that we know we need to do, the non-pharmaceutical interventions, physical distancing, hand hygiene, and cloth face coverers. But we are not out of the woods as far as our vaccination rates go. We are nowhere near a herd immunity status to where we can not worry about community spread. And so we need to continue to do the things that are important to prevent community spread until we can get as many people in Dunn County that want to be vaccinated. And so just a really short and simple statement that the Dunn County Health Department strongly advises mask wearing by everybody anytime they're outside of their home and around other people, particularly when social distancing is difficult. Not an order, but definitely an encouragement.
And Katie, this went to the media today?
It did. Like all of my press releases, they go to the media as well as some of our community partners so that it can be put up on our social media and other people's circulation.
Any comments or questions for Katie on that? Are we ready for finances?
And I would ask, and I just want to be really transparent, it has been a really crazy week. And so poor Sarah did not get my financials until today. I think I gave them to you guys before I gave them to her, but she has graciously stepped up and she'll be presenting today for me. Thank you, Sarah.
Yep. Can everyone hear me?
Thank you, Sarah. You're on.
All right.
We appreciate it.
Would you like me to share my screen?
Yes, please.
Okay. Can everyone see them? They should be highlighted blue and green.
Yep.
All right, great. Right now I'm on the expense tab for public health, and I'll just skip down and give you guys the summary. The grand total year to date, this is December 2020. I'm going to go and on the side of caution that this is not the final December 2020 yet. There might be some more revenue or maybe some tad bit more expenses that come into the department. So I don't want to put that out there that this is a final 2020 report yet. So I'll continue with that. The year to date expenses for public health are at $1,616,374.54. The revenue that the public health department has taken in so far is $1,628,932.63. That leaves an overage of revenue right now at $12,558.09.
They're amazing under the circumstances.
Does anybody have any questions or want to look at anything in detail? Again, that's just the summary right now.
Apparently not.
All right.
Thank you, KT and Sarah. Appreciate this. Anything else from the health department before we move on?
Just as a reminder, you guys will see there is a budget adjustment coming forward from the health department, and this we'll talk more about later.
Yeah, we have several action items related to what we've talked about. So, Human Services, Chris.
We can't hear you, Chris. Check your button on your headset.
No, I have to unmute myself.
Okay.
We're having some technical issues here in the office today.
I always just think we should be better at this by now.
I know, right?
It never works that way.
I know.
So I'm taking a little bit different path with you today. Instead of a sort of a standard report, I wanted to give you a little bit of background information. As you're aware from our conversations last month, as well as kind of in a number of public meetings, we've spoken to the CDBG grant that we have submitted for funding for emergency housing, sheltering, and transitional housing and case management services for folks, largely pass-through money to Stepping Stones and West Cap. But housing has been one of those issues which has bubbled along in a number of different ways for quite some time. We know from our work in criminal justice that we have people who are released on a regular basis, released from incarceration, who don't have a place to go. We know that I know from our work in human services that we regularly have families that are involved in the child protective services system, in which permanent stable housing is a barrier to reunification with their children. We know that we have people who are released from substance use treatment or mental health treatment who don't have a place to go. And in fact, we have had people stay an extended stay in treatment because they didn't have suitable housing to be released to. And then, so that's sort of the human services end of that. And then there are different pieces of a housing initiatives that are kind of, or housing focuses that are moving along. So out of the community health needs assessment, there is a group out of that that's specifically looking at housing, because that was identified as a priority by the community of something that they see. And granted, when you say housing, that can mean everything from soup to nuts in terms, and we'll talk about that in a second. But so the House Done Right has a work group that is focused on housing. We pulled together this kind of little informal group that worked on this grant that was largely based out of the CJCC with regard to trying to figure out how to address emergency housing this winter. We had a regular work group of kind of related county stepping stones, emergency government, different folks who came together on a weekly basis for a while to try to craft a plan. And that's where some of the funding has come from. We have a FEMA grant out there that looks like it will be granted for $105,000 for temporary sheltering. So that was moving along. About 18 months ago or so, the CJCC hosted, has a small work group that's looked at housing, and they hosted a community forum. There were about community discussion. There were about 100 people who showed up to talk about housing. The city of Menominee contracted with Cedar Corp to do a small housing study. And then most recently, out of the Health Done Right group, Chairperson Morehouse has been helping to spearhead working with West Central Regional Planning to look at how we might be able to do a more comprehensive housing study in Dunn County. Barron County and Polk County?
Yes.
Barron County and Polk County have both utilized the services of regional planning to do community-wide housing study, and it really has accomplished probably a number of things, but it's helped to narrow the issues within the communities, but it's also helped to engage community partners in understanding both that there's an issue as well as to help to begin to craft solutions. So I wanted to step back and just say, in all of the work that we've been doing, looking at the various, so I will tell you that I'm a reluctant housing advocate, because housing is one of those things that I think we've all played a little bit of hot potato with, because no one in the county is funded or supported in doing housing work. And yet it impacts, it impacts law enforcement, it impacts human services, it impacts public health, it impacts the jail and the criminal justice system. It just has broad-based impact. And then it impacts economic development, which is what we're going to take a look at here in a second. So I said, I don't have terribly long to retirement. So I said, housing might have to be my swan song. So if you can envision me in a tutu dancing around, here we go. Let that be your mental picture as you go to sleep tonight. Yeah, exactly. So I'm going to share my screen as well. I put together a short PowerPoint to kind of just give you a little bit of background information in case you haven't really had a chance to dig into housing and just understand how broad of an impact it actually has and what it looks like a little bit in our community. All right. So whether you start at the top and you go down, or you start at the bottom and you go up, there are housing challenges across our community. And so this was just some information that I was able to pull out of, most of it came out of the Cedar Corp report that they did for the city. So it's totally stolen from them and I didn't necessarily credit them. But so what we know is that housing prices continue to go up, and then subsequently the amount of income that you need in order to purchase a house continues to go up. So if you look at that first bullet point, is as recently as 2019, the median income for first-time home buyers was $68,000 and some odd change. And by 2020, a year later, it was up to 80,000. Home prices are anticipated to continue to increase this year, and Zillow forecasts that it will be the hottest spring in memory regarding housing. And so there's a variety of factors that are contributing to that. Very low interest rates. If you've looked at interest rates as of late, you can take out a 15-year fixed rate mortgage for just a little over 2%, which is essentially almost free money. Even a 30-year fixed rate is just a little over 3%, like 3.5%. So those are unprecedentedly low and have been that way for some time. People who have been stuck at home during a pandemic had realized that maybe they would like to have a different home. Millennials who have been a pretty late comer to the housing market as a group have also realized that perhaps there was a reason now to invest in housing. So there's a huge demand. If you've attempted or know someone who's sold a home here recently, many houses will go within the first day and oftentimes for over the asking price. And then the other thing that's contributing to issues are that lumber prices are have gone up astronomically. They have essentially, you see that number inched above $1,000 per 1,000 board feet in February, this February, which is double what it was 3 months ago. So if you think about what that looks like. So I just gave you a little picture. I grabbed this off of Craigslist. No, this is recent home sales. This is off of Zillow. These are some of what has sold in our community in the last roughly month. And you see this little tiny little white house here of 2 bedrooms and 1 bath, 15,000 square feet that sold for $153,000. And then onwards, up. So you can see that the houses are going for a lot of money. Our rental market is really tight as well. Fair market rent in Menominee is considered to be $614. This is a HUD figure, $614 a month for a 1 bedroom and $770 for 2. Currently on Craigslist and Zillow, if you looked at them the other day, there was 1 apartment within those price ranges. And the wait list for HUD housing, Section 8 housing is about 2 to 3 months. So these are some of those. This was the ads off of Zillow, or off of Craigslist. No, this might be Zillow. I don't know. Zillow, one day on Zillow. Zillow the other day. You can see that those are well above those numbers, except for this one over here for $550. They're well above that. Lots of them, when you look at these, this is another listing. This is Craigslist. When you look at these, you can see available 6-1, available 6-1, available 6-1, and even the ones that are available now are $845, $800, etc. So even the rental market is really tight. We've looked at this this information before. This is now getting to be somewhat dated. It's about 5 years old. The United Way sponsored these, has sponsored around the country this look at what it takes to survive, just to get by in your community. And they happen to do Wisconsin, and you can drill into this data. This is done county specific. You can also drill into a fair amount of data that's even more specific by township or village or municipality. But this shows you that, so for a single adult to just, and see, here's a single adult housing cost at $484 in 2016. And you see from those listings that you would not find a one bedroom for that. And you would have a difficult time even with two bedrooms, assuming you had someone that could, you could live with. But so in 2016, you needed to make roughly $10 an hour in order to just pay the basic necessities. And if you were two infants, adults, and two infants and an adult, how about two adults and an infant and a preschooler, then you had to make about $30 combined an hour in order to just meet the basic necessities. The term that they came up for this was called ALICE. It was called Asset Limited Income Constricted Employed. And it just means those people that truly are, as we might have historically said, the working poor. They are one paycheck away from a financial disaster. And this is the percentage of people in the townships, villages and townships by percentage that would meet that ALICE definition by income. And so you can see that the city of Menominee, it's about 56%, but it's not great in most places in the county. I think the least is 26% in Elk Mound, but you can see Voiceville at 67%. I think one of these it's even higher than that. But so HUD usually requires for low income housing, you usually pay about 30% of your adjusted income for that. And so I did the math on just minimum wage. And it would result in a rental payment of $377 a month on a $1,256 a month income. But HUD has significant barriers to permanent housing. They have a one-strike rule. Federal law requires that they exclude people who have certain criminal, I see it bullet pointed everything there, sorry about that, certain types of criminal records, but it gives them a broad discretion to deny even above that. And so there are a lot of people who either have a criminal record or an eviction record that will disallow them from housing assistance. And then I thought this was interesting. Landlords can buy there are tenant screening companies, and landlords can purchase collective information regarding eviction history. And that includes, so there was multiple examples online of people who've had, I'll say, unfair evictions filed. And then they were dismissed, but because they had been filed, they'll show up on these collective lists, and then people will have an eviction history from which they cannot find reasonable rent after that. And then, other things that people have more responsibility for, but nonetheless create barriers, poor references, history of damaging previous property, conflicts with people that you lived near, prior lease issues. All of those things make it difficult to have people find a place to rent. So now I'm going to take just a quick little dive into, this comes up every year in budgeting on the county level, but I thought it was super interesting to graph it out a little bit for you. So the county is able to raise the amount of levy that it spends by something called net new construction. And you can see the definition there. Net new construction is basically whatever you built that year, residential, commercial, whatever, reduced by anything that you tore down. So if you had two lots sitting next to each other, and one had $100,000 home that you built, and the other had a $10,000 building that you tore down, then it would take the 10 grand off of the 100 grand. And then the levy limit is calculated by dividing this current year's number by last year's equalized value. And so I thought this was just super interesting. I apologize that in this graph here on the right, I couldn't figure out how to get these 1, 2, 3, 4 to be years to save my soul. And I finally just had to quit because like 20 minutes later, I realized I just spent about $75 trying to make 2020s out of these. But these are the same thing. These mirror these other ones here. So number 1 is 2020, 2 is 2019, 28, 2017. So here you see our equalized value, which, as you would expect in a community, and you see the development that's occurring in our community, you see this number going up, going up, going up, which is good. That's great news. But I thought this was the really interesting place. This is the net new construction. And then it's parallel influence on levy. And you can see that outside of this year here where it popped up in 2018, it's dropped and it's dropped. So while the existing things that are here continue to raise in value, we're not building enough stuff to keep this being a robust number. This is out again. This is now almost 3-year-old data. This is out of that Cedar Corp study. This shows you, this comes out of census data. This shows you for households that make less than $20,000 a year, how many owner-occupied houses there are, and then how the estimate of how many that you would need to fill a gap. And there it's 62. But here's the other end of the spectrum where I said where it doesn't matter if you start at the top up or the bottom down, from essentially the top down, bottom up. Top down, for household incomes of $100,000 or more, there's an estimated housing gap of 340 houses. And that was, again, 3 years ago. I can only imagine that that number is potentially, I don't know, guess whatever you would wish. I'd say double that. I don't know. So obstacles to affordable housing include building costs. It costs just as much to build low income housing as it does market rate housing. Costs of land and lumber. Regulatory barriers. It is estimated that public processes and requirements can raise costs by 30% or more. Increased complexity of environmental regulation, and then the ever popular NIMBY, not in my backyard. So this shows you just some, again, you look at this and you think about the fact that that one piece of information that I said that lumber costs had doubled in just the last 3 months, but you look at some of these increases over 10-year periods of time in terms of what it costs to put in streets and sidewalks and water and electric and all those sorts of things, and how that continues to rise. So developers aren't chomping at the bit to develop. And then this is just specific to, these are just, I grabbed them right out of emails that I had from WestCap and from Stepping Stones. The WestCap data you haven't seen before, but they didn't have a emergency rent assistance program in 2019. So there aren't numbers to compare that to. But they did have 58 homeless intakes for Dunn County in 2019, and in 2020 they had, I'm sorry, it's hiding behind you guys here. I don't know what it says back there. 59, but they helped 100, and so that number stayed kind of the same, but they helped 128 people this year so far with rental assistance. And I see today there was a information that came out on Whisk Politics about Governor Evers had put 330 million, I think, into rental assistance that'll go to the CAP agencies. So they will continue to have an ability to help some people with rent assistance going forward, at least for some more of this year. And then you've seen this data before, the Stepping Stones data. In 2019, they housed 55 adults, and in 2020, they housed 146. But more tellingly, they used to be able to get people out of emergency sheltering in under a week, and now sometimes it's 6 weeks. People come out or longer, they come out and they go immediately back on a waiting list because they can't find housing. This is just a little picture of their shelter, which is right next to their building. This is Winter Haven, which was one of the shelters. This was Winter Haven, which was unable to open this year because it is entirely volunteer staffed. These are Stepping Stones has the only emergency sheltering of any capacity in Dunn County. So I sometimes think about Heidi Hooten, their shelter coordinator, and I think about the difficulty of her job on a routine basis, telling someone that she has literally no way to assist them in finding housing, more stable housing. So the intersect for us, I looked at, so this bottom is our dashboard. It's just a part of our criminal justice dashboard, but it shows you the number of bookings into the jail each year. And so I just took 2019s. In 2019, we booked 1,986 people into the jail. If 5% of those people who are discharged from jail had housing insecurity, that would be 100 people a year. We have family treatment court and adult treatment court participants and their families for whom we struggle to find safe and stable housing. We have people leaving, as I mentioned earlier, people leaving substance abuse and mental health treatment placements or staying there longer because we can't get them housing. We have child protective services families. We have staff seeking to live in the community in which they work. We have impact on net new construction. We have recruitment of workforce and industry. I still think back to a presentation that Eric Turner did as the economic development director a few years back to the county board, in which he said that talked about recruiting industry to come to the county and then not having either enough workforce and or housing for those people to live in. That would work. And so if you want to build a factory that's going to house or going to employ 100 people, you have to have 100 people to work there. And you also have to have 100 places for those people to live or something close to that. And then obviously housing and its impact on the tax base. So it was just kind of it's just a way to get you thinking about, I know that we're going to work with West Central Regional Planning to look at doing a more comprehensive housing study. We've been fortunate in all of the COVID-related money that is flowing around, that we have been able to procure that CDBG grant, as well as looks like some FEMA funding for temporary emergency housing. But that's a little bit of a finger in the dike or a Band-Aid on a gunshot wound when you think about just putting somebody in a hotel for $70 a night and yet having nowhere to have them come out of and be able to be safely and stably housed going forward. So I wanted to give you some exposure to that because I think we're going to be talking about housing a fair amount in the next, until I dance off of the stage.
Might be one of those issues, because it is so pervasive, that rises to the level of a county priority for housing. That's something we could think about, but yeah, it's an enormous issue. Thank you for that, Chris. That's very helpful.
And then Sarah will do the financial report.
Okay, thank you, Chris. Can everyone see my screen? Should be highlighted with a little bit of orange color and some green.
Yep.
All right, great. I'll just do the summary again. DHS's grand total of expenses is $14,141,520. I have split that out for the operating and the salary. The operating cost projected for this is December 2020, just to let everyone know, and this is our second version of this. I still won't say that it's our final version. We might still have some more expenses or revenues coming into there. So to keep that in mind, our operating for DHS is $9,092,192. The salary for those is $5,049,328. So that comes back up to that $14,141,520. The budgeted and now projected revenue that we've brought into the department, this includes state grants, other funding sources, and insurance billings. Wimker shores up from the building department. That comes to $10,518,548. Then the bottom number there is $3,622,972. That is the amount of county levy that we will use out of the $4,096,708. So with all of that being said, I know a bunch of numbers to all of you, but it looks like DHS will return $473,736.
Excellent.
Questions?
Are there questions for Sarah or Chris? Thanks for all these data. It's helpful.
You're welcome. Thank you.
I would just say that we didn't do 2021 yet because it's essentially meaningless to you. We would in February be paying all of our expenses from January, and it takes the better part of the month for those to come through. So we would essentially run you a report that would have very limited data. So in March, we will be able to run you a 1 month report, which still is kind of like wonky, but at least starts to get a little bit of a picture of what our financials look like.
Okay, moving on. We have 9, I think, action items, a bunch. We have a bunch, to be scientific. The first is the vouchers for January. I will need, you have that in your packet. I'll need a motion to note review of the January 21 vouchers paid. Do I have a motion? Supervisor Crom removes. Is there a second? Do I have a second?
I second, Sarah Kennedy.
Supervisor Kennedy seconds. Any discussion?
So I would just say, I asked Sarah if she would run through real quick. I sent you this afternoon in light of our conversation last month. We will start to pick away some of the items. And so we just picked a handful of them. Sarah, if you want to just do a quick run through of some of the items that showed up on the vouchers this month.
Sure. There was House Calls of Menominee, and Chris, you can interrupt anytime you want. House Calls of Menominee is where we do business with and get our leased staff. So these are employees that act and look like Dunn County employees, but they are not their house call staff members. So we pay house calls for salary fringe for a fee. So that's those. There's also Chris Hassenberg, which is filed maybe on your report as Go Monthly IT. We get most of our computer equipment from them, our scanners, our printers, our laptops, telephones, all of that stuff. Then there are maintenance fees for, I might be abbreviated on your report as WRS, but it's Waiting Room Solutions. That is our medical billing software that holds all of our clients' data where we do our billing from for our insurance companies and stuff. Then there is another one, Karen DeSmith. She does our home delivered and meals, correct, Chris?
Yep.
Yep. She does all of our home delivered meals that we contract with. Anything else?
Any additional questions or discussion before I ask for a vote on the vouchers? All in favor of approving the January 21 vouchers signify by saying aye. Aye.
Aye.
Aye.
Any noes? Great, the vouchers are, we will note review of the vouchers. Action item B is a resolution supporting increased funding for aging and disability resource centers. I could use a motion to approve. Supervisor Kennedy's, I saw your hand first, moves, and Mr. Lamb seconds. Chris, any detail that you want to provide here?
I think the background information is pretty self-explanatory. There's been not a serious look at the ADRC funding since they were incepted in 2008. And so this is a initiative encouraged on a statewide level for advocacy for a relook at the funding for them.
Questions or further discussion? All in favor of approving this resolution for increased funding for ADRC, please signify by saying aye.
Aye.
Aye. Any opposed? Resolution passes and will go on to the board. 9C, a Department of Human Services 20 to 21 budget carry forward.
Are there any questions on that?
No questions. I need a motion.
So moved.
Bonnie Barker, is there a second?
Second.
Supervisor Cromery. All in favor? Aye.
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 Any opposed? The DHS carry forward is approved. 9D is also a budget carry forward request from Public Health. I need a motion on this as well. Ms. Barker, is there a second?
I'll second.
Mr. Lamb, any discussion, questions, any details? KT or Sarah?
Again, it's pretty self-explanatory. Most of those things are dedicated grants that need to be used for dedicated things, and we, because of our response to COVID, have not been able to do so.
Absolutely. All in favor?
Aye.
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 Any opposed? The budget carry forward for public health is approved. Item 9E is a budget adjustment. You have that document in your packet. This is for the Public Health Department. I need a motion on this. Supervisor Cromery moves. Is there a second? Ms. Barker, any discussion, any additional information?
So I would share that this is the large amount of dollars that we are expecting specifically from the previous federal allocation passed through the state for vaccination specifically.
Are we ready to call the question on this? All in favor, say aye.
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 Any opposed? Budget adjustment is passed and goes on. Veteran service. This is a budget carry forward in the amount of $5,632. I need a motion on this.
Also move.
Mr. Lamb, is that a second, Supervisor Cromery?
Second.
Thank you. Thank you. Any discussion here, Greg? Anything you wish to add?
Not at this time.
All right, let's call the question on this one. All in favor, say aye.
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 Any opposed? Budget carry forward for veteran service passes. Number 9G is a resolution that comes from the Health and Human Services Board in support of the health advisory, which was issued today and which KT ran through with you. This is a resolution that puts this committee in support of the incredible work that's been done by our health department, and further in recognition of the fact that this pandemic is not over, to support a health advisory that recommends the wearing of cloth face coverings as an effective public health action. There's no budget impact on this, but this is in support of both necessary public health action and the incredible work of our health department. This didn't come out until today, and I am sorry. I thought that it went in your packet earlier, but you do have it before you. I would like a motion to move forward and approve this resolution. Ms. Barker, is there a
I just have one question.
Could I get a second first, Jody? Is there a second?
I second.
Supervisor Kennedy seconds. Yes, Supervisor Cromrie.
Okay, so just based on the CDC site, I don't have a problem with this resolution at all, but based on the CDC site, I just want to make it inclusive to those marginalized individuals that are not to wear a face covering. Was that included in there? Those groups that are instructed by the CDC to not wear something?
So there is no call out on children under 2, people with health impacts that prevent them from wearing a cloth face covering, or anything of that sort. It's not in the language.
Would that be able to be added?
So the advisory has already gone out. So my advice to wear a cloth face covering has gone out. I believe that the resolution, Chairperson Morehouse, still can be amended if a caveat wants to be put into the resolution.
There are background data, are there not, in the health advisory that would direct people to the information that Supervisor Cromrie is asking for?
Yes, so information in the links do talk about exactly the CDC's recommendation on who should not be wearing masks, including small children and people with underlying health conditions that prevent them, but it's not specifically called out in the recommendation to wear a cloth face covering.
Understood.
We have a motion and a second on this Health and Human Services Board resolution supporting the health advisory issued by Dunn County Health Officer on February 25th. I'm going to call the question. All in favor signify by saying aye.
Aye.
Aye. Any opposed? Resolution passes unanimously. And finally, the last item, back to the discussion on the directional plan. I think what would be the most appropriate going forward is a motion that would direct your chair, that would be me, to work with the health department and our planning staff on crafting a health policy that would be incorporated in the directional plan, with drafts to be provided by the committee and action to be taken on our next meeting, which is March 25th. So would anybody care to make a motion similar to that which I just stumbled through?
Can I just say so moved?
Yes, you may say so moved. Thank you, Ms. Barker. Is there a second?
This is Bill Lamb. I will second.
Okay.
Can I just run by the language to just make sure that this is sort of what you want to say?
You're going to.
I think it's okay. It's a motion to direct the chair to work with the health department and our planning office on crafting a health policy that would be drafted for review at our March meeting.
That's fine.
Included in the directional plan.
Included in the directional plan. Yeah.
Okay.
Yep. Moving forward.
Yep.
Okay. Are we ready to say yes or no on this? All in favor?
Aye.
Aye. Any opposed? So we'll be working on that over the next month and get that back to you. Any announcements? Anything anybody wants to add before we adjourn? If not, with your permission, we are adjourned. Thank you all very much. Stay healthy.